Age-related changes in the joints cannot be completely stopped, as natural wear of the body occurs in every living organism. The joints of a 60 to 70-year-old person always look different on X-rays compared to those of a 25 to 30-year-old. However, the degree of these differences may vary. A person who wants to remain active and healthy as long as possible should take care of their musculoskeletal system in advance and make efforts to prolong youthfulness. It is important to maintain a balanced and healthy diet, follow a proper hydration regimen, and drink at least 1.5 liters of clean water per day. Carbonated drinks, juices, coffee, and sweet compotes are not included in this amount. Adequate intake of vitamins and minerals is essential. It is also important to care for dental and oral health, and, if necessary, undergo dental treatment or prosthetics. Avoid stress, hypothermia, overexertion, and other conditions that weaken the immune system. By following simple rules, it is possible to prolong youth and activity. Even if age-related joint changes have already progressed, it is never too late to slow their development and improve your condition. The amount of synovial fluid decreases with age, especially in people whose immune system functions improperly. As a result of insufficient moisture, joint tissues gradually wear out, become thinner, fragile, and less elastic. As a compensatory mechanism, the body begins forming bone growths in areas of greatest friction, which can ultimately lead to loss of mobility. The result of such changes is osteoarthritis, which may affect one or several joints. People with chronic digestive problems lose the ability to properly absorb essential minerals with age: calcium, magnesium, zinc, silicon, and selenium. Insufficient water intake also negatively affects nutrient absorption. However, retirees often avoid drinking large amounts of fluids due to fear of swelling or bladder problems. Excess weight is a true killer of joints, yet many elderly people are overweight. The opposite extreme, underweight, is common among lonely elderly individuals who survive on a small pension and cannot afford polnocenous nutrition or vitamin and mineral supplements. Why do joints start to hurt with age? Changes in the joints usually begin to appear after the age of 50 to 55. At this age, a person may start experiencing nagging pain in the morning, stiffness, clicking, and cracking sounds during movement. The cause of degenerative and dystrophic processes in the joints lies in the decrease of water content in connective tissue, as well as the slowing production of collagen and elastin, which causes cartilage to lose its strength and elasticity. The first negative changes may begin as early as 30 to 35 years of age. However, they often remain asymptomatic for a long time. In addition to cartilage dehydration, the amount of synovial fluid in the joint cavity decreases in older age. This fluid acts as a lubricant. There must be enough interarticular fluid to bathe the joint surfaces, soften movements, and limit friction. Synovial lubrication moisturizes the cartilage, preventing cracking and drying. Its consistency is similar to raw egg white, which helps it remain on joint surfaces for a long time. Changes in the amount and consistency of this lubricant make the joint vulnerable to stress. Main causes of joint wear in older age. Many retirees lead a sedentary lifestyle because they are afraid of worsening chronic illnesses and also have less strength and energy. In retirement, many people move to the countryside or spend more time at their dacha. However, gardening work does not necessarily improve health. It places repeated stress on the same joints and muscles and can cause injuries, hypothermia, muscle spasms, and nerve compression. After retirement, people often have to economize, so they buy fish, vegetables, fruits, and dairy products less frequently. Due to dental problems, retirees often avoid eating vegetables, nuts, and seafood, limiting their diet to soft and semi-liquid foods.